Dr. Harshal Ingale. I'm interventional cardiologist at Rubial Clinic, Pune. So today we are going to discuss some few important points regarding inclisiran. As we all know that this is something new which has recently been available in India, especially for very high risk ASCVD patients with deranged LDL cholesterol who had more than 2 events of cardiovascular, including heart, stroke, or any peripheral artery disease. So first, what are the optimal and safe targets for LDL-C levels for high-risk ASCVD patients, and how long can we go lowering the LDL-C and mortality benefits? Now, see, considering the recent guidelines or the recent trials which have come, Indians are especially at a very high cardiovascular risk because of the high truncal obesity, because of high incidence of diabetes mellitus plus dyslipidemia. We are a country with a very high consumption of unsaturated fatty acids. Now, coming to the question, how much cholesterol needs to be under control? So, ideally, the LDL-C cholesterol, if you don't have any other cardiovascular risk factor, we can get it up to 90 LDL level. But if there is any cardiovascular risk or diabetes, hypertension, or any previous CV event, the LDL cholesterol should be at least brought down to less than 55 of LDL. Next. Now, the recent studies, the various trials which have come, including the Orion trials, have shown that the lower the LDL, the lower it is better. So according to the 2023 guidelines, they state that LDL-C should be less than 55 milligram per deciliter, especially in a very high risk patients, or in patients with second CV event within 2 years. So especially in those patients, the LDL-C cholesterol should be at least less than 40. Even the 2022 ACC, American Cardiology guidelines, also state that a patient with a very high risk of ASCVD should have LDL-C cholesterol less than 50 milligram, or it should be more than 50% of reduction. Even the 2023 Lipid Association are consistent with the ACC and ESC. They say that in a very high risk CV patients, you should have a LDL-C level for at least less than 50. Next. So these are the various trials and showing the effects of LDL-C. Now, we all know that inclisiran, it has recently been launched in India. It specifically works in the liver. It works by interfering with the RNA at the cytoplasmic level. It is not acting at the nuclear level. So risk of malignancy or any mutations is very less. So it acts by conforming or reacting with the single sRNAs. Next. So inclisiran, where it is indicated. So inclisiran is indicated in all the dyslipidemic patient, especially patients with familial hypercholesterolemia, familial mixed dyslipidemia, whose cholesterol levels are more than 90 or more than 100. And especially if we see many patients with a family history of heart disease or familial dyslipidemia, their triglycerides level are more than 400, LDL is more than 250. This patient, regardless of any ASCVD event, should be started on high dose statin, plus you can add on some other drugs, second line drugs, and even on these tablets, if it's not controlled, then you can consider inclisiran, especially in this patient, because inclisiran has showed a very good results, especially in this class of patients. As I've already discussed, that very high ASCVD patients who have a family history of heart disease, who have a cholesterol level of more than 100, who are diabetic, hypertensive, who had a recent cardiovascular event like stroke or heart attack, MI, or any peripheral artery disease. So especially in this patient, inclisiran should be considered for a tight control. If patients are already on high doses of statins, ezetimibe or bempedoic, and still their cholesterol levels is not controlled, so this patient should be put on inclisiran. So, as we all know, this is a subcutaneous injection which comes in a formulation of 284 milligram in 1.5 ml with a pre-filled syringe. It's usually given at an interval. First dose, after the first dose, second dose is usually given at 3 months, and the third dose is usually at the 6 months of interval, and so on. So, the first dose and the second dose, the interval is a 3 months, and after that, every 6 months, this injection should be repeated. Even after a first or even after the second doses, we have seen LDL cholesterol coming down to almost 15, 20 without any side effects, without any major weight loss or any other side effects like allergic. Now, how is the doses? Well, we have already discussed the doses. After the first dose, second dose is given at 3 months. Then after that, every 6 months, this should be repeated. Even a 3 or 4 doses of inclisiran is enough, because we have seen that based on the Orion trials, they have shown there is a legacy effect even after stopping inclisiran. The effect of LDL cholesterol control stays for at least 3 to 4 hours. This has been stated and already proved in Orion trials. So if we miss a dose, if we take a first dose and if we delay, or by somehow the second dose is missed, you can take it immediately. It's not an issue. And if you're transitioning from a PCSK9 inhibitor like evolocumab, if you have already taken a dose prior day or a day or two or a week prior, you can just shift on to inclisiran. There's no waiting period. It's not like that you have to take after 3 months or after 6 months. You can just start from the next day right away. Already discussed patients of dyslipidemia with ACS, especially young patient. Now, as we see, many young patients are coming with acute heart attack, no any prior history, but when we see their lipid levels, it's through the roof. LDL cholesterol almost 120, 150, even 200 we have seen. So any ACS patient with dyslipidemia, we have to consider inclisiran for the maximum benefit. Or any patients who are on maximum tolerable doses of rosuvastatin, ezetimibe, bempedoic acid, but still their LDL cholesterol stays above 55. In this patient, we should consider a PCSK or a inclisiran to get their LDL cholesterol less than 55. Even patients with CKD, uncontrolled diabetic, even elderly patient more than 75, we can consider inclisiran. There is no any contraindications for these patients. Next, so these are the same guidelines. Even the NICE guidelines say the same thing. Patients with the very high risk or high risk of CVD with LDL cholesterol more than 90 should be started, who have on maximum tolerable doses of statin, ezetimibe, and bempedoic. This patient should be considered for inclisiran, as major trials have shown that it's a very beneficial. ACC expert consensus also recommends inclisiran for ASCVD and hereditary familial hypercholesterolemia. Even we have seen, even I, in my practice, I have a family who's having, almost all of the family have a cholesterol level of more than 400. LDL cholesterol is about 250. Father, mother both had a history of ASCVD. His son and a daughter are around the age of 21, 22. They have no other risk factors, but we have already we have put them on statins, bempedoic, and we have also advised them inclisiran. So the son, we have already started on inclisiran. His LDL cholesterol has now come down to almost 110, 120 with a single dose. Continuing it. Next. So as already discussed, Orion is a major trial which is conducted over a long period of time for, especially for the inclisiran. Well, the results will come. Phase 3 have already shown a very good results. Next. So the pooled analysis of Orion 9, 10 and 11 has showed a sustained LDL-C reduction of almost 50% and an effective reduction of 50.7% at 510 days. So clearly with inclisiran, the LDL cholesterol has definitely come down, and this should be considered. Next. This graph is also showing the patients who are on inclisiran. This is the ORAN 18 patient with ASCVD. You can see the graph, it's already showing a divergence at a very early initiation of the drug. So it has shown almost 57.2% reduction in lipoprotein A from baseline compared to 41% than the placebo. Next. Orion trial 10, it has also shown a very good result compared to the placebo, almost 33.6% of reduction in total cholesterol compared to placebo. Lipoprotein almost 21.9, which is a very significant amount of reduction. And even LDL, HDL cholesterol are also seen to be increased with inclisiran. Next, if we see the safety profile over the long trials, over the pool data, it has shown a very few serious side effects. Just some patients who were on inclisiran had shown new onset hypertension, some upper respiratory tract infection, some allergic, some mucocutaneous, but no major side effects were seen, no major or any deaths were seen because of the side effects of inclisiran. So the long-term safety data, it has shown it's a well-tolerated proven safety up to 6.8 years of exposure. The Orion 8, which is an open-label extension trial for Orion 3 to 11, almost 3,000 participants, and long-term efficacy and safety of twice yearly inclisiran in patients with high cardiovascular risk and elevated LDL-C. Inclisiran could reduce LDL levels in long term while being well tolerated. Inclisiran acts in the cytoplasm of hepatocytes and not in the nucleus, so there is no risk of carcinogenicity and immunogenicity. Results from the Orion 8, the largest long-term safety and efficacy follow-up trial with inclisiran conducted to date, show inclisiran could reduce LDL-C levels in long term while being well tolerated. So almost 82.7% of patients enrolled had a ASCVD. So the Orion 4 and the Victoria 2P are ongoing cardiovascular outcome trials with completion dates to be anticipated in 26-27. While the results of these trials are ongoing, the recently published pool analysis of 9, 10 and 11 had shown a very good cardiovascular benefits of treatment with inclisiran. There was almost 26% reduction in composite MACE compared to placebo over 18 months, with fewer MACE compared to placebo. And the randomization studies with 20 million person years follow-up have proven dose-dependent log linear association between absolute magnitude of exposure of the vasculature of LDL-C and risk of ASCVD.